This is Dr. Ben Pearl with FitFoot U. Today we are talking about a chronic arthritic, mild arthritic, let's just call it that, or microtrauma of the big toe joint, the first metatarsal phalangeal joint. In one of my patients, it's training for the Kona Ironman. So she's been running a lot. We're going to have her cool her jets for a little bit, but if we pan in for just a moment here, we can see at this joint, there is definitely some jamming there occurring. It's a very tight joint space. This is not a fracture situation. When I look at the top-down view, what's called the AP view, we see that there's a little flattening in the joint, but no fracture. She does have what's called a bipartite sesamoid. That could also be adding to the mix. That is not a fracture. That's a naturally occurring thing. That's like a cleft in your chin. Now, let's look at what she's wearing, and let's look at the wear pattern. What we have here, this is the Hoka Rincon. Now, she's put 5 months of training on this, but I'm going to try to apply equal pressure. Look how much that's bending at the big toe. 33 stack height on this. So you'd think 33 millimeters. Here is another shoe, the Topo Ultrafly, only 28 stack height. They both have a 5 millimeter drop, heel to toe ratio, which isn't a lot. But even though this is 5 millimeters less, it's also the EVA composition. This might be more like a buttery EVA composition. This one's a little more sturdy. Watch me try to bend this. I can barely bend it. So when we think of stack height, we also have to look at the bake of the EVA to determine which shoe is best for you. Till next time, this is Dr. Ben Pearl with FitFoot U.